All right, good morning and welcome to our introduction of our MIPS reporting dashboard. We are so excited to show you this new feature in Office CMR. It will help all of us to track how we're doing with the advancing care information. It's where you will go to perform your data extracts, and it can also help you select your improvement activities. So first things first, if you don't see the MIPS dashboard in your reports section, let's go ahead and show you how to add access to your user base to this new screen. So we're going to go here to the lower left-hand side of the screen and click Setup. And we're going to scroll all the way down to the bottom and select roles. If you are not an administrator at your practice, you will need to have an office administrator do this. Up here in the search, we're going to go ahead and do a search for MIPS. Now, the first screen that comes up, we will ignore, and we're going to search again until we find this MIPS Mingle data extraction. And then you're going to want to go ahead and turn that on for any of the roles in your practice that you want to have access to this report. If you want certain people to just be able to see the report, you can always add read only to them and give the administrative full right access. So after we've added that, we're going to go ahead and save our changes. And now all of your employees that you've given access to this report can see it. So let's go ahead and go down to the lower left-hand corner. We're going to click on the reports portal. And if you are already in this portal, you may need to come up here and reset your current window. That will go ahead and pull that new screen down for you. All right, so the screen that we were on is the MIPS Mingle screen. It's right under your old provider dashboard. So if you're going for meaningful use for Medicaid, you'll still use the provider dashboard to meet your meaningful use objectives. If you are going after the Medicare MIPS program, you'll want to be sure that you're using this MIPS Mingle dashboard. So when we first come in this dashboard, you'll see for 2017, we don't have any providers added yet, so we need to set up our providers. To add a new provider, we're going to click this new icon up here at the top. You can just search for your provider then. So we're going to add Isabella Hall. She's going to do 90 days, and we're going to start her at October 1st. Okay. This is automatically going to calculate a 90-day reporting period for you, and we'll just hit save here. And that's going to add Isabella out here to the left. You'll notice we're getting a warning. It's saying that we've not built any of the information for the provider, so we're not going to go out and automatically calculate all of the data for you, unlike the old dashboard. And we're doing that because the old dashboard, every time you went in there, it was calculating information on the fly. And for a lot of our practices, that dashboard became very timely. It wasn't very fast at opening. So we're building this dashboard a little bit differently. So when you're first adding your providers, just go ahead and click OK to that message and just add all of your providers. So let's say we wanted to add maybe Patrick Hines out here as well. Same reporting period. Again, if you're doing a group, you'll all have the same reporting period, and we'll hit save, and then we'll hit OK. So after you've gone through and you've added all your providers, again, step one is you want to add all of your providers. The next thing we want to go do is run all of the calculations. So to do that, you click on this little hammer icon out here under the quality section. You're going to get a message that this is going to go out and build all of that data for you, and that you're going to receive an office communication when the build is completed. You can hit OK. If you're a smaller practice, this may take maybe 5 minutes. If you're a larger practice, it could take several minutes for this process to run, as we're going to go out and for each provider, we're going to pull the advancing care information data as well as all of the quality data. Okay. So let's go ahead and we'll just go over this dashboard a little bit while our data is being pulled. You'll actually see that it looks like last night was our last pull. So this is a quality section, and this section is going to show several things. It's actually going to show for all of the providers you set up for your practice. So as you start exporting data to submit to the Mingle on their dashboard, you'll start seeing lines show up here that you have done an export of data. It's also going to show you when the data was last built. So Isalus Healthcare, every night we're going to go out and we're going to perform the build. We're going to go out and look for your quality data. We're also going to go out and calculate all of your advancing care information data. If you need to, again, refresh that on the fly, you can hit the hammer icon. And again, you'll receive an office communication when that data has finished building. Okay, but every night for sure, we'll go out and calculate that for you. So that's the quality section. Again, this will show for all providers. You've got a refresh button here. So it looks like our data has been calculated. As you'll see, the last build is now showing us today at 9:35. Okay. And then again, if we need to export data, maybe you have just purchased your Mingle Analytics package and you need to submit your initial PM data, then what you can do is we can either do it for your selected provider or better yet, all providers. And then it's going to show you what we have out here to export. So we could do a practice management export. We could do clinical medications, observations, etc. Okay. And then you would just click the download button and that would download into your export, Isalus export folder. Okay. All right, so let's go ahead and go into the improvement activities. So these are going to give you a list of all the improvement activities your practice can go after. If you're a larger practice, you have 15 or more eligible clinicians, then you will need to perform either 2 high, you could do 4 medium, you could do 1 high and 2 medium improvement activities. For all of our other clients, you will need to do either 1 high rated improvement activity or 2 medium rated improvement activities. And we have several improvement activities that many of our clients can already say that they're doing. Based upon services, you might already be engaged with Isalus Healthcare on, for instance, using telehealth services. If I click on this, if you're already providing telehealth services, then that is a medium weighted improvement activity. The same with chronic care management. So there may already be improvement activities that your practice is already doing, so this won't be any additional steps for you. But go ahead and take a peek at all these improvement activities if your practice hasn't already selected these activities, and find ones that easily fit into your practice, okay? All right, so that's your improvement activities. And then this lower section is your advancing care information. This is the old meaningful use, okay? Now, it's very important that we go over this because the way meaningful use worked and the way advancing care works are completely different. So with meaningful use, each of the objectives had a threshold, a minimum threshold that you had to meet. With advancing care information, you have a base set that you have to meet. It's very easy. And then you're essentially trying to get an additional 50 points by performing well with the other objectives, okay? So there's not necessarily a certain threshold you have to meet. You just need to perform well with several of the objectives that you have listed here to gain additional points, okay? So before you go any further with advancing care information, you have got to get this base score. It is worth half of your points for advancing care information. And again, if you don't do one of these 4 items, then you can't get any points at all in advancing care information. So that's a big difference that you'll want to make note of, that you've got to do the base score. And you'll notice that down here at the bottom, we're showing you your score. And while you've got 20 points racked up with performance, you're still a 0 score because your base score has not been met, okay? So very important. First, you got to meet this base score. So this should be pretty simple for you. You're sending at least one e-prescription. You're probably showing a yes. I'm in a test database, so it's showing no. You've got to perform that security risk analysis, and this is something you have to attest to. This is not something Isalus Healthcare does or can help you do. If you need additional help from a third-party company, you can click here, and this will give you a link out to some of our partners that we work with that will help you perform a security risk analysis for your practice. This is a practice-wide analysis, so once you complete it, you'll just hit this attest yes checkbox, and merely hit close, okay? Health information exchange. This is where you will be sending a referral summary of care to one of your providers that you refer a patient to. So in order to meet this measure, first your patient has to have a referral order, and they need to have been seen with you during your reporting period. And then second, you need to have a direct email, and you need to send a referral summary of care to that provider using direct. Direct email is not regular email, so sending, using your Yahoo or Gmail account, that's not going to count for this objective, nor is it secure. This is something that you have to send with a very specific direct email, okay? And then lastly, you have to provide patient access. Again, this should be pretty easy for you. When you're checking out patients, we're automatically creating a welcome to my medical locker welcome letter. It walks your patients through getting started with my medical locker. If you're printing that letter out at the checkout process, your patients will count towards this, okay? So that'll help you get those base measures. And then again, you're just trying to perform well in either the performance and the bonus categories doing the objectives. If you're actively engaged with an immunization registry, you would want to come here and attest yes that you're doing that. That's going to get you 10 percentage points. And then again, as you're securely messaging patients, as you're providing them patient-specific education or providing them access to their chart with that welcome to my medical locker welcome email or letter. And also as you're performing med reconciliation, you're going to be racking up points. And again, your objective is to get an additional 50 points from your performance and your bonus categories. Okay, so that is an overview of the MIPS dashboard. We will be having additional webinars on this. We invite you to come join our Facebook page group. We've got a new MIPS support group. It'll be a place for you to ask questions and also see more quick help videos, and that will be where we post all of our future events for help. So thanks for joining, and if you have any additional questions, please reach out to your iCELLis implementation manager or comment below the video. Thanks and have a great day.